Presently in South Africa, experts, medical professionals, and activists are gathered for an international congress. And joining us now on the phone from the Congress is Ingrid Daniels of the World Congress of the World Federation for Mental Health. Ms. Daniels, welcome to InFocus.
Good afternoon, Linord. It's great to be part of your program and to talk about this very prestigious and historic Congress that's being held on African soil. It's the first time in Sub-Saharan that we're hosting this Congress.
Indeed. And tell us some of the highlights. This has been ongoing since Monday. Tell us what has been happening.
Yeah, we've had a fantastic program. We've had basically over the past few days delegates coming from across the globe and in particular from developing countries. And for us, that's a real highlight to have such a wide expanse of people coming. Basically for us, the highlight has been that we've managed to gather over 876 delegates from across the world. We've covered areas and topics in particular around upscaling services to people living with mental disorders in low-resource settings, and looking at the impact of poverty on mental health and really what recovery means to people with mental health needs. I think for us what has been important is the grand challenges in global mental health, pushing that mental health becomes a priority on government and countries' agendas, and that appropriate resources are allocated to ensure that we provide these services. We've dealt with issues of stigma and discrimination because these are the two main areas that are the major barrier for people living with mental illness across the world, in fact, but obviously worse in developing countries.
Now, when we talk about developing countries, it seems, with the specifics of Sub-Saharan Africa, it seems like mental health indeed is not very much addressed as opposed to other diseases like malaria, HIV/AIDS, when it comes to African health on the international scale. Tell us about what is happening on the continent.
Yes, I think in countries like South Africa, and particularly the urban areas, you'll find that those areas are better resourced in terms of mental health care facilities, community-based initiatives and programs. But the minute you get into the remote villages and communities, and that applies to Sub-Saharan Africa, you'll find that many of those villages and areas have no psychiatrists, have no mental health care practitioners. And what we're needing to do is to really start training lay counselors to identify early diagnosis of patients, and so that we can, because the earlier the diagnosis, the better the treatment and the better the prognosis and the outcomes. And if we're wanting to reduce the burden of disease on countries, then it will require governments to upscale services, but to also think of innovative practices that are cost-effective for these low middle-income countries.
And quickly, in 10 seconds, what is next after this Congress?
Well, what will come from this Congress is the Grand Challenges in Global Mental Health. The initiative, the Grand Challenges Canada, has made available $225 million over a 5-year period to fund innovative projects, and they're really focusing on integrated innovative projects with social innovations to fit in to health systems across the world. So with this funding, organizations and countries can apply and ensure that we can start rolling out services.
Great. That's all the time we have. Ms. Daniels, thank you so much for joining us.
Thank you so much.
And our thanks to Ingrid Daniels of the World Congress of the World Federation for Mental Health for joining us from Cape Town, South Africa, today on InFocus.
Well, thanks a lot, Linord, for those updates on mental health. And viewer, do not forget to join Linord Moudou for her health reports every Tuesday and Thursday right here on InFocus.